Medicaid policy shifts, funding pressures, rising costs. Community health centers are navigating one of the most challenging environments in recent memory, and yet they continue to innovate and serve their communities. In the final part of our conversation with Jessica Yanow of the Arizona Alliance for Community Health Centers, we reflect on lessons from Medicaid Unwinding, what sustainability may look like over the next decade, and why innovation, communication, and community voice will be critical to the future of care.
Let's talk a little bit about Medicaid Unwinding 2.0, what we learned. So now that we have more of a perspective on Medicaid Unwinding, what have we learned about what worked and what didn't?
What was great about Arizona is that we adopted various approaches that other states didn't always adopt to ensure that people weren't falling off the rolls. I think that we have been grateful to have state leadership that has been really committed to making sure that people maintain coverage. So Access used an ex parte process. They used a national change of address database. They aligned renewal dates by household. They had beneficiary touch points. And all these different strategies helped minimize the number of folks losing coverage. Mm-hmm. And so I think what we learned from that is, yes, we should use all those resources, and health centers are also a critical part of making sure that folks remain covered. And so during that time, we did a lot of communication directly with Access and with health plans. Health plans were sharing information with health centers to help make sure that they could reach out to folks to make sure they didn't fall off the rolls. And those are things that really worked well. I think that probably no system is perfect. And if you look at Access's data, you can see for the folks that lost coverage, like what the situation was, why they lost coverage. I'm sure there are things that could be done to improve the number of people that retain coverage, but I feel like overall our state did a pretty good job, especially if you look at that data compared to other states. So I think that some of the best practices that came out of that situation, specifically in health centers, were refining workflow processes for eligibility staff, using technology and internal data to outreach patients, creating a no wrong door approach for people that are seeking to renew their Medicaid coverage. And so I think we need to really lean into all of those. We should have continued to lean into all of those things, right? But we really need to lean into all of those things again, especially as we move towards the implementation of HR 1 and work requirements. We did more training with clinical staff as well around if they identified somebody didn't have coverage, making sure that they then got them connected to somebody in the health center that could help them. So we've already been in discussions with MCOs in Arizona around how we work together to ensure that people remain covered, and we'll continue to do that.
So as we kind of wrap up here and we're looking at our crystal ball of the future for FQHCs, what do you see 10 years from now? What changes feel inevitable? What are your thoughts, just off the cuff?
Off the cuff. Okay. I think this is a time period that is really going to test health centers. Right now, we have this combination of rising costs, flat funding, at least in terms of grants, and a complex policy and regulatory environment, and I don't see that changing anytime soon. My off the cuff that sounds slightly negative, but probably true, is that, nationally we expect that there's going to be some consolidation among health centers. I do not want to believe that for Arizona. But the reality is, I think that some of these pressures are likely going to force health centers to reevaluate their ability to continue operations. That would be devastating. It's devastating in Arizona to think about, but I think we do need to be prepared that might be something that would eventually happen. And our goal would be to provide as much support as possible in whatever that looks like, and ensure that people don't lose access to care in their communities if there are those transitions. And then I also think, on a more positive note, I think the environment we're currently in is as challenging as it is something will have to change at some point. So I don't want to say this too shall pass, because I think I don't know that that's the right thing, but things are going to evolve.
Yeah.
And I don't think we can assume that they're going to evolve in a way that's negative for health centers either. I think that folks continue to innovate, to show up, to be there for their communities, and we find all kinds of opportunities there. So what I would like to see in 10 years is that we have a strong, thriving network of health centers in Arizona that are sufficiently funded to do the work that they're tasked to do, that people in Arizona communities are able to receive access to care. What it looks like getting there, I think, is, where there's that uncertainty.
Yeah.
Is that really depressing?
No, but it's scary.
It is scary.
I think for sure it makes me think about the Blockbuster videos of the world that failed to innovate.
Yeah.
And, they're no longer here with us.
Think about Netflix. Do you remember when they had that model? They would send you the DVD in the mail?
Yeah. Or Redbox?
Yeah.
Maybe does that still exist?
No,
even?
it just went out of business recently.
Yeah.
Because I think it was too inexpensive to cover the cost of.
Yeah.
But Netflix did innovate, and look where we are, right?
Yeah.
And we pay a bunch of money to them every month so we can watch what we want.
Definitely. So I think, innovation, it's the key, I think, to any business's survival and their sustainability. You have to be open to trying new things, and innovation to me doesn't necessarily mean some new tool that I'm using. It could just be a different way of thinking, re-engineering my thinking to look at things from a different perspective.
Well, and I think the opportunity is also to try the new things and to try some of the things where you have room if they don't succeed, right? Because part of how we learn also is to make mistakes and to then retool it and try again. And I think that's kind of where health centers need to be, is trying to do whatever they can to innovate and hopefully having the room to try some things and figure out whether they work or not.
Yeah.
No, I think that really is key to sustainability. I don't think that the healthcare environment in 10 years will look nearly the same as it does now. I am hopeful that it will be a situation that will be better both for providers and patients, our entire healthcare system. But I think that, yes, in the current environment, you're absolutely right. The ability to innovate is what helps you be sustainable and stay relevant.
Yeah.
So I think health centers have done a good job as we've talked about threats at state or national levels to health centers, do a really good job of getting information out to their patients about the impact of the health center in the community and how it impacts them on a personal level. And so I would say that just the work that they already do to outreach, to communicate, to create relationships, right? That's really what it's about. I would say that's probably the critical piece. We've had health centers do postcards to elected officials where their patients did the postcards, and the patients talked about, this is what having this resource in my community means to me. And so it's not that the health center told them what to write. The health center just said, if you would like to tell them about why you value the health center, please do that. And they did. Yeah. And so I think there is always that opportunity. And it's going to look different depending on the health center, but it is important. And I think we talked about communication in terms of leadership last time I think I was here, but I would just say that communication in terms of helping our patients understand the work that we're doing, helping our partners understand the work that we're doing, helping our funders understand the work that we're doing is so critically important too. And we can't say it enough times. That's the other piece. I think whatever that data is around how many times you need to hear something before you actually absorb it, we can't do it enough.
Yeah. I think that bringing our patients along is definitely a key factor that something that might sound good to us, we're like, oh, this would really help, might not be the same perspective from the patient's point of view. So hearing their voices and, getting their feedback as we continue to innovate and think about sustainability and transformation, that we're reaching our hands out to them and making sure we're bringing them along too.
Well, and I think that's why it's so important that health center boards are at least 51% patients, right? Because then the community is invested in what the health center is doing, and the community is providing feedback. And you're right. I think, you can tell me that I need to do X, Y, and Z because this is the data in my community. But if I don't see it as a problem, I'm not going to do X, Y, and Z, and I'm not going to go to your program to do it. But if the community sees it as an issue, they will come along. And that's actually one of the things that I think not only makes health centers unique, but I think it's what makes them really strong, is that community voice in the leadership of the organization.
Yes, as I was running my surgical tech program, we had an advisory board. I had an advisory board for my program. And one of the most important people that sat on that board was my patient advocate, the person that represented the patient in the community as far as the discussions that we were having and what we were doing in the program and what was happening in the field. And, those sort of things was definitely a really important piece there.
I think what I would say is we've been on a wild ride. We're still in for a wild ride. And I think the bottom line is hang in there. Health centers are such an important part of our healthcare system. So many people, bipartisan people, do believe in the work that we do. We do have that support. And I think sometimes challenging times do provide the opportunity to innovate. So don't give up on that. Find the silver linings. Yeah. I think that's really important. And also that we're in this together, right? And so those relationships that we can develop to do work collaboratively they're always important, but they're really important right now.
Yeah. No, I just love that we ended on this very positive, hopeful note with our conversation, even though things are scary and tumultuous and we're not, exactly sure what exactly is going to happen in the future. I just want to say thank you so much for coming back and having this conversation with us. Your perspective is truly invaluable. Thank you so much.
Thank you for having me again. It was lovely to be here.
Yeah, it was great.
Over the past 3 episodes, we've explored policy, workforce, partnerships, innovation, and sustainability. And one theme has remained constant. Community health centers are built on relationships. Even in uncertain times, their mission remains steady: to serve patients, strengthen communities, and adapt to whatever comes next. Thank you for joining us for this 3-part series with Jessica Yanow of the Arizona Alliance for Community Health Centers. This has been The Exam Room. We'll see you next time.